Hello and welcome to another TLDR video. Ever since US President Donald Trump started talking up and then taking the drug against the advice of his own public health advisors, discussions surrounding the potential role of hydroxychloroquine has been rising, with doubts being cast about whether the drug is actually effective in COVID patients, with a series of blunders. So in this video, we're going to take a look at how the drug came into the public view this time round, and what's actually happened. A quick promo before we start. You might have seen that we've made a new product called Brexit the Colouring Book. So if you're stuck inside and wanted something to do, a little throwback to all the Brexit stories we used to cover, then check out the book. It contains 15 drawings, and alongside each, you'll find a description of what happened, taking you through the whole Brexit process. So not only is it a colouring book, but it's also a nice timeline of the process that even comes with a video exclusive for purchasers. Find a link to the book in the description, along with a special discount if you order now. So first things first, what's hydroxychloroquine? Hydroxychloroquine is an anti-malarial drug typically prescribed to prevent and treat acute attacks of malaria, as well as lupus and rheumatoid arthritis as a last resort. Hydroxychloroquine and chloroquine are both named in the World Health Organization's model list of essential medicines. Neither drug is licensed for use in the treatment of coronaviruses, although small-scale studies in China and France at the very beginning of the pandemic suggested that it might help. Soon after, a World Solidarity trial was announced by the World Health Organization, and the US Food and Drug Administration on the 28th of March issued an emergency use authorization for both hydroxychloroquine and chloroquine. Now, this doesn't mean that the FDA knows or even thinks that it works, only that they're allowing for the otherwise unapproved usage of the drugs in order to combat the virus. From then on, it continued to gain traction, and within a few days, Brazilian President Bolsonaro uploaded a Facebook post claiming that hydroxychloroquine was totally effective in tackling the virus, a post that was then later taken down by Facebook for breaching their misinformation guidelines. Trump then came out saying, "What do you have to lose? Take it."
There's a possibility. And I say it. What do you have to lose? I'll say it again. What do you have to lose? Take it. I really think they should take it. But it's their choice. And it's their doctor's choice or the doctors in the hospital. But hydroxychloroquine, try it if you'd like.
Then the issues started to gradually occur. On the 24th of April, the FDA then issued a drug safety communication, warning against the use of both hydroxychloroquine and chloroquine, due to the risk of heart rhythm problems. A little over a month later, on the 22nd of May, a damning paper on the use of hydroxychloroquine and chloroquine as treatments of COVID-19 was published in the Lancet Medical Journal, one of the most esteemed global journals. The paper supposedly compiled and analysed data from 671 hospitals in 6 continents, comprising of just over 96,000 patients hospitalised with COVID-19. The paper concluded, "This study of patients with COVID-19 requiring hospitalisation found that the use of a regimen containing hydroxychloroquine or chloroquine was associated with no evidence of benefit, but instead was associated with an increase in the risk of ventricular arrhythmias and a greater hazard for in-hospital death with COVID-19. These findings suggest that the drug regimens should not be used outside of clinical trials, and the urgent confirmation for randomized clinical trials is needed." This was seen as a major blow. Instead of being harmless and potentially life-saving, the drug was associated with an increase in risk of heart problems and in-hospital deaths. The very next day, the World Health Organization suspended the hydroxychloroquine arm of its trial because of the concerns raised about the safety of the drug in the paper. So it looked like the verdict was in. The drug didn't work against COVID-19, and further trials were being ended. That was until the 3rd of June, when an expression of concern surrounding the medical paper was raised, alerting readers to the fact that serious scientific questions had been brought to our attention. Then, on the 4th of June, the medical paper that caused the WHO to stop its trials was formally retracted, after 3 of the study's authors could no longer vouch for its veracity, with The Lancet in their retraction saying, "After publication of our Lancet article, several concerns were raised with respect to the veracity of the data and analyses conducted by Surgisphere Corporation." The Lancet attempted to have the report independently reviewed. However, it emerged that this wasn't possible, as Surgisphere refused to transfer their data due to client agreements and confidentiality requirements, meaning that the report couldn't be properly peer-reviewed. But it wasn't just the Lancet questioning this research, with the New England Journal of Medicine then withdrawing a separate paper, this time on cardiovascular disease, drug therapy, and mortality in COVID-19. Because the data used in this report had been based on information from the same organisation, the Surgisphere Corporation. A Guardian investigation went on to reveal that several employees of the US-based company have little or no data or scientific background, with an employee listed as a science editor appearing to be a science fiction author and fantasy artist, and another employee listed as a marketing executive turning out to be an adult model and events hostess. Regardless of this controversy, there was a substantial final blow to the drug. A major study led by Oxford University into the efficacy of the drug against COVID-19 conclusively concluded that it was ineffective. Over a month ago, the UK launched the world's largest randomised clinical trial of potential coronavirus treatments, with nearly 1,000 patients from 132 different hospitals initially recruited to take part in the randomised evaluation of COVID therapy trial, known as Recovery, and more than 11,000 patients are now taking part. 3 main drugs were put up for trial: lopinavir-ritonavir, an HIV drug, dexamethasone, an anti-inflammatory steroid, and hydroxychloroquine. Given mounting doubt and controversy surrounding the drug, given the pooled medical articles, on Thursday 4th of June, the UK's drug regulator, the Medicines and Healthcare Products Regulatory Agency, requested a review of the data, and the results are stark. A total of 1,542 patients were randomised to hydroxychloroquine, and compared to 3,132 patients randomised to usual care alone. There was no significant difference in the primary endpoint of 28-day mortality, with the trial concluding there was no beneficial effect of hydroxychloroquine in patients hospitalised with COVID-19. This is not a treatment for COVID. Peter Hornby, Professor of Emerging Infectious Diseases and Global Health in the Nuffield Department of Medicine at the Oxford University and Chief Investigator for this trial, said hydroxychloroquine and chloroquine have received a lot of attention and have been used very widely to treat COVID patients despite the absence of any good evidence. The recovery trial has shown that hydroxychloroquine is not an effective treatment in patients hospitalised with COVID-19. Although it's disappointing that this treatment has been shown to be ineffective, this does allow us to focus care and research on more promising drugs. A sentiment echoed by his colleague. Martin Landry, Professor of Medicine and Epidemiology at the Nuffield Department of Popular Health, again at the University of Oxford and Deputy Chief Investigator, said there has been huge speculation and uncertainty about the role of hydroxychloroquine as a treatment for COVID-19. Today's preliminary results from the recovery trial are quite clear. Hydroxychloroquine does not reduce the risk of death among hospitalised patients with this new disease. This result should change medical practice worldwide and demonstrates the importance of large randomised trials to inform decisions about both the efficacy and safety of treatments. What do you think about all of this? Should we be open to all kinds of different treatments, or is it irresponsible for figures like Trump to be promoting untested cures such as hydroxychloroquine? Let us know your thoughts in the comments below, and as always, you can get involved in the conversation over on Discord. One last reminder, if you do want to support the channel, then you can pick up any of our products, including Brexit the Colouring Book, which is currently at a discounted price. Find all of our merch at tldrnews.co.uk/store, and your purchases directly help the channel. Be sure to subscribe and hit the bell icon to be notified every time we release a video. You can also find more from us across all social networks simply by searching for TLDR News. Special thanks to our Patreon backers who make videos like this possible.